we are back. Yeah, baby, we are back. All right. Whew. Movements at synovial joints, gliding, angular, rotational, and special movements. Did you guys know you had special movements? Special movement powers. Sorry, that was not a burp. All right. Now, the joints. Now, synovial joints, we probably covered a little bit how there's different types of joints here where there's cartilaginous joints where it's just cartilage in between, like the pubic symphysis and these intervertebral discs. And the ribs have cartilaginous joint with the sternum there. And then fibrous joints. So fibrous, where there's the sutures, gomphoses, and syndesmosis, right there, semi-mobile, immobile, okay? And we're getting there, guys, we're getting there. Every other joint in your body is a synovial joint, okay? And this is how synovial joints work. This is obviously supposed to be a finger, I believe. And this is, guess what? An articulation. In the previous video, I was getting anatomical landmark and articulation mixed up. Probably because I haven't gone over this in 10, 15 years, but whatever, we're doing it. Articular capsule, and guess what that means? That's right, it's an articulation, and it's a bone meeting another bone. That's the articular part. And the capsule, you guessed it, is a capsule. Like a pill, okay? So it's encapsulated, right? And that is the space where it has encapsulated this joint. And why should it do that? To protect it, A, okay? And then B, keep it free of infection and keep it moving smoothly with this wonderful synovial membrane that creates fluid in between the joints. Now, people who have too much fluid will have a big puffy joint, like if you were to jam this finger, okay? It would puff up and swell, and why does it puff up and swell at the joint? You guessed it, it's this synovial membrane trying to repair damage, having all these damaged cells and producing too much fluid, and then it swells. Here you go. That's what swells, folks. In the joint, when you get damage to the joint, this thing will blow up much larger, like a balloon, because it actually kind of is like a balloon, alright? And it's not too hard to imagine it doing that. And people can have that problem with their knees. Okay, if you have a swollen knee, that's what's swollen, is the synovial joint or bursa, okay, which bursa sacs produce synovial fluid, and you can get bursitis, which I had talked about, okay. These are the different motions of the fingers, which is actually really cool, folks. Did you know your fingers had totally different types of joints in there? For instance, like the thumb has what's called a saddle joint. And I can't see myself, but it rocks back and forth on the saddle. And yeah, it's like the saddle of a horse. It sits over, okay, and there's and it moves back and forth. It's pretty dope, pretty cool. But hips and shoulders, that's where we get more special movements, because they're the most mobile joint in the body is the shoulder, which mine is a little stiff right now. You see this guy just going around and around. Nothing else does that in the body, not really. The hip kind of does, but not like the shoulder. The shoulder is by far the most mobile and by far the most unstable, okay, for that exact reason. Okay, angular motion is going to happen at what we call a hinge joint, like your knee is sort of a hinge joint, and I say sort of because we'll get to that, but the elbow is definitely a hinge joint, and so its motion is a lot more angular instead of gliding. Now, gliding can happen. Let's just go here. So these, well, I'll say here. So gliding, and it's showing here atlas and axis, which is C1 and C2. The first cervical vertebrae is called C1. Okay, it's the very first neck bone. Don't panic, all right? And axis is C2. C2 first, or the second cervical neck bone vertebrae is called axis, and they're the only ones that have those special names, and there's a definite reason why, and it's because atlas, like if you ever heard of Atlas holding up the world, Atlas C1 will hold up the skull. You'll see these two articular cartilages here, and that's where the occipital bone will sit, and axis is a big, wide, flat, sort of, frisbee looking vertebrae. It's the only one that looks like that, and you can pick it out in a pile easily. And axis is the same way. It's very different shaped than all the other ones, and that is because it has this little thumb-like projection called the dens. Okay, and atlas sits on axis, which you see the world tilts on its axis. Okay, your head moves on its axis. It's held up by atlas, and it rotates around. And guess what? This is sort of the no motion. Okay, that is sort of a gliding motion, and it's a pivot joint. So it pivots around. Atlas will pivot around axis and rotate. Okay, and it's more of a gliding motion. Angular motion, rotational motion. So we talked about, the forearm, it kind of rotates, right? And this bone rotates around the other bone, and then the special movements, which I'll get to later. But flexion, extension, the elbow, flex. Did you know when somebody says flex your muscle? Well, really, you're creating flexion at the elbow, okay? That's what's actually happened. The flexion is at the joint, okay? Not the muscle. You're tensing the muscle, you're contracting the muscle, but flexion, that's flexing elbow, okay? And flexion is when you're moving a joint towards your body. Extension, to extend, is when you're moving a joint away from your body. Okay, and the head, so flexion for the head, man, it looks awful. But flexion, bringing the chin down. Okay, so towards myself, and this isn't an angular joint or an angular motion. Okay, so we talked about adduction and abduction. This is in more of a horizontal or coronal plane, I believe, and this is more in the sagittal plane. Okay, so when we're in the sagittal plane, it's flexion, extension, and then we're abducting out this way, more in the coronal plane. Okay, so we're putting some stuff together, so don't freak out. Your hand will flex and extend. Your knee will flex and extend. Okay, the wrist okay, bringing it down towards itself, flexion, just like the head. If you imagine your chin is your palm and you're bringing it to your chest, same sort of deal, okay, and extension away, okay, and this is all from the perspective of anatomical position, okay, so anatomical position is where we start, okay, flexing forward, extending away, okay, so in anatomical position, I'm flexing forward, I'm extending away, okay, and then flexion here with the leg is a little different because we're bending at the knee, we're flexing it up back towards the body and extending it straight out. So it's like bent and straight. Okay. And there's our adduction and abduction that I've already talked about. Yes, it happens at the shoulder and it happens at the hip. It doesn't really happen, I don't want to say it doesn't happen anywhere else, but those are the main places. I don't want to say anything completely wrong. Yeah, there it goes. Hand. Okay. Abduction of the fingers and thumb, wrist. There's abduction and adduction happening in the hand and wrist. Now, lateral flexion, okay, in the coronal plane. To my knowledge, this is the only place that this really happens, is at the spine. Okay, the spine is able to laterally flex. The spine can laterally flex. It can flex forward and extend. It can rotate as well. So your spine is very mobile. Now, special movements. We talked about special movements, and that is it right there. Circumduction. Okay, circumduction is a special movement of the hip and shoulder. And there is another one. I believe the thumb can do that. It's sort of like circumduction, but not. You know, we'll get to that. But it's from a saddle joint, not a ball and socket joint. And it's actually a collection of different motions. Circumduction is. But there you go. I was talking about that rotation, that kind of gliding motion of Axis and Atlas, and there they are. There's the DINs, that thumb-shaped projection. You could pick these out of a pile, guys. It's super easy to tell which one is Atlas and which one is Axis. If you're ever in a test and you see a vertebrae and it's shaped like that, guess what? And especially it has these big cups on the top. That is definitely C1 every time. And if it has a DINs, it has this thumb looking guy right there on top, it's definitely C2. Period. Here's some structures of cervical vertebrae. Cervical vertebrae, you can tell them apart very easily because they have transverse foramen. Now, don't freak out. Foramen just means a hole. Okay, there's a hole, transverse on the sides, transverse side hole. Okay, transverse foramen. All right, if it has a hole over here on the side, it's definitely a cervical vertebrae. Period. We're not going to have any of those on any other type of vertebrae. And there's your C1 right there, talking about it there. Lateral rotation, medial rotation. These are motions of the shoulder and the rotator cuff. You've probably seen rotator cuff exercises done this way. Lateral rotation, medial rotation. And it's not adduction and abduction. It's rotation. It's happening at the shoulder, okay? The shoulder and the arm bone, the humerus, are staying next to the body, and the shoulder is rotating. we're seeing the forearm do all this stuff, right? But that ain't it, guys. The motion is happening at the shoulder, and the shoulder is rotating. So therefore, this is rotation. Okay? You could make arguments otherwise, but yeah. All right. Pronation and supination. Don't freak out. And there it is. I told you about this. That bone rotates around over the top of the other bone. And which bone is it? What's the story? Which bone? Okay, so which bone moves and which one stays stationary? And you can tell that on the pinky side there, the ulna, that's ulna, good old faithful ulna, is going to stay in the same spot. And the radius, now, what does radius do? Radius rotates. Radius rotates. And it's going to rotate actually here at the radial humeral joint, humeroradial joint, whatever, and rotate around its head, okay, and folds over the ulna. Now, supination, okay, supination is when it's palm up, is supination. And it's so dumb, but holding a cup of soup. Like if you were to hold a cup of soup, you'd be holding it in supination. Pronation, to pronate, to go prone, okay, is face down. Whenever we talk about a patient laying in prone, that means they're face down. And if they're supine, that means they're face up. So supine, face up, prone, face down. And you might even see it in old literature where, you know, there's a figure prone on the ground, you know, and talking about war or something like that. It means face down. Depression and elevation. This is another motion of the shoulder. Okay. Depression and elevation. You can see it right there, shrugging your shoulders. Okay. And obvious elevation to elevate, to move up, and to depress is to go down. And plantar flexion and dorsiflexion, plantar flexion, also aka extension and flexion. I don't know why we gotta have special names, but we do. But plantar flexion, plantar fasciitis, bottom of the foot, is also flexion. Okay. And from anatomical position, you are moving this down and towards itself. This is, if you think about it like the same way as the hand, it's going like this, okay? That would be the foot pointing down. That's flexion. Plantar flexion is flexion. Dorsiflexion, no, the dorsal fin of a dolphin or whatever. Dorsi is back, okay? Dorsal fin, back fin, okay? The dorsal side of the foot is, yeah, it's the top of the foot. And it dorsiflexion, going up like this. If you look at it like a hand, it's going like that. And what is it when it's doing that? When it's the hand, it's extension. So that's how you can really tell this apart. Don't necessarily think, if somebody asks for extension or flexion on a test, don't think of it as the foot, think of it like the hand. It's going down, that's flexion. It's coming up, it's extension. It's the same way with the foot. Don't get it confused. Inversion and eversion. Okay, now guys, this is fancy talk for the foot. Maybe there's a lobbyist in the for podiatrists for this. I don't know, but this is just fancy talk for supination and pronation of the foot. Okay, Anybody any running clubs or whatever, and they talk about you're overpronating or something like that. Now, supination, okay, palm up. Now, which direction with this foot would the foot be going palm up? Okay, and that's inversion, where your foot is trying to turn itself palm up. That's supination. Eversion, okay, when you're going down, pinky side up, is more pronation. The inversion, they came up with this because it turns in. Eversion, it turns out. Aversion, so if you had an aversion to, spiders, or you have an aversion to eating spicy food, you're avoiding or trying to move away, okay, from it, right? So eversion. Protraction and retraction. This happens a lot at the chin, which is your mandible at the chin. Protraction, it sticks out. Retraction, it goes back in. If you think about it, kind of like a snake flicking out its tongue, it retracts it. Okay, there's that. Now, opposition is specific to the thumb, the opposable thumbs. Okay, and when they say opposable, it can oppose the pinky opposition. Okay, it's very specific to the thumb. Alright, we got a vertebral column here showing you all the fun ways of the vertebrae. Now, this doesn't have transverse foramen, and it has these little articulations on the side. This is definitely a thoracic vertebrae. And these guys, they look like a moose, if you can see that. They have this great big schnoz. They are definitely lumbar vertebrae. Okay? Now, these guys with these articulating surfaces on the transverse processes, the reason why they're definitely thoracic vertebrae is because the ribs attach here. There's an articulation, bone meeting another bone, and it's the ribs. And where the ribs are, that's where the thoracic vertebrae are. Okay? When a rib touches your vertebrae, and it doesn't have a hole on the side, on the transverse foramen, a side hole, it's definitely a thoracic vertebrae every time. And there's also little articulations here on the body. It's an easy way to tell them apart. These are fun. Kyphosis, scoliosis, and I don't see lordosis, but it's another one. Oh, there it is. Lordosis. Okay. Lordosis. And that's, we're making fun of it, but this is quite painful. A lot of patients, especially with osteoporosis, and, there's all different ailments of the spine, will end up with what you call a hunchback. Okay. That's kyphosis. Kyphotic spine. Lordotic spine is this extra curvature of so it is in the lumbar region. It's lordosis, lumbar lordosis. And the thoracic region, this happens when, like I say, osteoporosis can happen. There's warping of the ribs, and just imagine how hard it is to breathe from a position like this. So if it's in the thoracic spine, it's kyphosis. If it's in the lower spine, the lumbar spine, it's lordosis. And if it's happening in a transverse or side to the side direction, it's scoliosis. Okay. We're getting into some neck muscles here, which is really cool. don't get me wrong, I don't know if I was ready to take you guys there quite yet, and some of these smaller muscles of the vertebrae. But if you're ready to hit them, we'll hit them. Don't get me wrong. There's the spinal cord and components of the spinal cord. Yeah, we're gonna get real serious real fast here. So yeah, if you go with me, we'll go. The back of the neck and these muscles, if you think about it, your chin, if we go out here, where's the protraction guy? This is out in space. And what's holding it up? All these muscles back here. Okay? That's it. Dude, that chin sits out, okay, like a cliff ledge, like a ledge. And you have a lot of muscles back here holding your face and chin up against gravity. These muscles do it all. They hold it all up. Now we're gonna get a lot more technical into the muscle side of things and postural muscles and shoulder muscles. I don't know, maybe I'll save this for another video so we can do muscle and make this kind of a separate thing. I don't want to overload this one video, okay?